Hi, I'm Joan Landino Says.
And I'm Jane Says, and we've decided to join forces
And bring you Therapy Twins. Today's topic is,
cognitive behavioral therapy.
what's that mean, Jane?
The basic principles of cognitive behavioral therapy, or CBT, came into psychiatry as a form of therapy in about the 70s. The basic principle is we all have automatic negative thoughts and we all have automatic positive thoughts. Those are the ones we want to keep. So,
Which is so difficult, because if you really think about it, when you really think, you're going to say, wow, I can't believe how negative I was.
it's actually simple but not easy. You're absolutely correct. Because if you sit down and try to start identifying your negative thoughts, you might find 3, 4 in a day. By the end of that day, if somebody was observing you, it's more like 300. Similar to sleep apnea. Someone says, oh, I stopped breathing 1 or 2 times a night, and they actually get a sleep apnea test, and they've actually stopped breathing 30 times in a minute. So part 1 is identify automatic negative thoughts. For example, I'm a loser.
I'm a loser. I am totally adequate for all situations.
I'm employed. I pay my bills on time. And I've begun dating and taking an art class. There.
And my behaviors inspire others to treat me with respect.
So back to the scientific part, because it is science evidence-based medicine.
Which is very hard for some people to believe, because they would say, those are lies, I'm lying to myself. Yes, once you figure out that they're lies, go with it, because does a pathological liar, I hear people say this all the time, he's a pathological liar and he believes his lies. Perfect, he's doing cognitive behavioral therapy in reverse and being negative towards himself. Go ahead.
And in just about almost antisocial behavior quality. Anyway, cognitive behavioral therapy is used in psychiatry for almost every disorder, from depression to anxiety to OCD, PTSD, and even psychosis. Minus psychosis, CBT can work on its own just as well as the psychotropic medications.
So well that insurance companies reimburse extremely well for it and actually recommend CBT. But why are so many people, as well as myself in the beginning, so opposed to it, Jane?
Again, it's simple but not easy. Think about being severely depressed or in a highly anxious state, and your therapist actually says to you something like, Joan, the way you're thinking really does affect your feelings and emotions. We're going to try something new. I want you to start doing some homework.
Oh, well, I'm done with school. I don't want to do any homework. No.
So we sort of begin together. We begin together sometimes by using ourselves, and we identify some of their negative thoughts. It's not uncommon for me to say, Nancy, that's a very powerful negative affirmation. Let's work on that.
Or Alice, I'm sorry, I just counted. That was 10. Time out. We're moving towards the positive. Go ahead.
One important part
is
those negative thoughts are so deep-rooted that if you say 3 or 4 positive thoughts in a day, what do you think is going to win? Your deep-rooted baggage.
The negative
So there's a
thoughts.
portion to CBT called challenging those automatic negative thoughts. So be careful. The gentleman who says, I'm a loser, and then he says, I have a job, I pay my bills on time, I've begun dating and taking an art class. If he doesn't in between say something like, no, that's the old Joe. Was that his name? Doesn't matter.
I don't remember.
There has to be challenging of the negative thought. So he could say, that's the old Joe way of thinking. The new Joe likes himself. I'm employed, I'm taking an art class, I pay my bills on time, etc. That's the piece that's the most difficult for people to remember, the challenge.
This is what sometimes bothers me. Okay, so we pour the glass. Is this half empty or is this half full? People will say half empty, people will say half full. Some people will say, I'm a realist. and that they won't even answer the question. Really? So it's true that it's half empty. Are we used to it being half empty? Of course we are. Did people bring me a book on positive affirmations? Did I throw it away? Of course I did. But then one day, Jane tricked me and said, can you say this affirmation? Which was, the door to my heart opens inward. I thought, all right, that says I love myself. I can probably do that. So I kept saying the door to my heart opens inward for months, didn't stutter whatsoever. And all of a sudden people started saying, wow, you are doing so well, Joan. What are you doing? I said, well, apparently I love myself. Now I'm doing really well. That's not what the door to my heart opens inward really meant. Jane tricked me. Thank you very much. What did it really mean, Jane?
It's forgiveness work.
And it is so tough for the forgiveness. It says
Extremely tough for people to
that not only do I
forgiveness work.
forgive everyone for all perceived wrongs, I'm not excusing behavior, but I also forgive myself for not being perfect. Would I have ever said that? No, I would never have said that. So thank you for two people. One person who said their lies, which got me going, and thank you, Jane, for pointing out all of my negative comments and thoughts. Oh, and our self-talk is also negative. In our head, as we're making our bed, brushing our teeth, you don't even know, but you're actually thinking, and sometimes they're negative. Get rid of that too. Again, don't be hard on yourself. What you could say is, oh, that was what I meant to say was that was the old Joan. Now what I mean is, I have a fabulous, lucrative job. I have my own radio station with my twin sister Jane, etc.
I'd like to add to the glass half full, half empty. At this exact moment in time, both are true. The glass is half full. I know, it's off a little bit. The glass is half empty. We utilize this sometimes to show people that you have a choice to view it as half full or empty. You have a choice to make the positive affirmations or cancel the negative automatic thoughts. In the goal, the basic goal is to improve interpersonal relatedness. Your interpersonal relationships in your jobs, your homes, road rage, outside your home.
Oh, I don't even have road rage anymore. Now they're super citizens in front of me, or what a nice person. They're going extra slow and they wouldn't cause any damage to a car. A lot of people don't like this, but a lot of inpatient and day programs utilize this as well in hospitals, but they don't say negative and positive. Apparently that might be out of vogue or too simple. They change it up, which I think is hilarious, to this is a irrational thought, change it to a rational thought.
This is a maladaptive way of thinking. Let's change it to an adaptive way of thinking. It's all the same.
And then one other place says this is ineffective, an ineffective thought, change it to an effective. Can't we just move towards the simple to positive versus negative? And that's about it.
I like effective. I like that word a lot.
You do? All right, effective versus ineffective. All right, so this is Therapy Twins signing out, and we hope to see you next time.